Atlantis American Financial Report editorial on the HCA healthcare financial statement. HCA happens to have industry-leading revenues. However, it has a revenue per dollar of asset that falls far short of other market players in nearby industries. This means there's an opportunity for personalizing the physicians at HCA better with the patients in that community, in all of the communities, which we took a look at all the states that are in operation in. Felt like they had more operations in like Texas, and noticed that they don't anymore. They were very familiar with them up here in New Hampshire, which is where I happen to live. We have an Atlantis 1, 2, and 3 product that is built to show the chivalry of the soul, the chivalry of biology, and both. It happens to have the 13 measures of chivalry that are detectable and different between individuals. If you talk to patients and market your physicians to patients in the personality type that your physicians happen to be, patients will never be let down if you're honest with them about who your physicians are individually. And so that opportunity is to invest in personalized marketing for HCA physicians, affiliated physicians, and help utilize HCA facilities by better personalizing physicians. There is not a personalization initiative noted by any of the bondholders. There's not a personalization initiative noted by the accreditor. The bondholders and creditors are wrong. HCA is a storied organization that's had a very successful finance side of the house, particularly the latest stream of fundraising, but has not produced the revenue benchmarks per dollar of asset that it really needs to get the highest investment grade ratings. That's something we'd like to help with at Atlantis American. We happen to offer psychometrics. There's other folks in the market that are familiar with Myers-Briggs or the Hogan. We have an assessment that's far deeper. It's 13 traits of chivalry that are distinguishing in all Homo sapiens, specifically physicians, particularly physicians, and it makes all the difference. You tell patients who your physicians really are, and your patients will never be let down. Looking at HCA Healthcare, there's 182 hospitals, 126 freestanding surgery centers, 21 freestanding endoscopy centers. How many personalized marketing surveys do HCA physicians need to take to promote HCA to fill and fully utilize all of the company's assets? And again, there's 13 different measures of chivalry. Chivalry matters everywhere where HCA is in business. Chivalry still counts. Chivalry works. Chivalry has always worked. We know that the standards for chivalry haven't gone out of fashion, and that HCA physicians will meet those chivalry expectations of consumers. You simply have to promote those standards, and we'd love to tell you what they are. We're available at profeed.me. Again, looking at the financial statements, the majority of expenses at HCA are cost of revenue items. Costs can be classified as general and administrative, including the corporate office, which were $378 million, $400 million, $416 million for the years 2022, 2021, 2020. The salary and benefit numbers at HCA are a little high, given the revenue production. The finance work, again, of lining up creditors, lining up the latest bond issuance in the last 12 months seemed rather successful. Raised a lot of capital, didn't produce revenue for the amount of debt that was raised, and saddled by very high overhead expenses, which can be overcome by fully utilizing the facilities. Again, personalized marketing of those physicians. Looking at revenues, revenue growth slowed in 2022 from 2021. There's significant revenue growth 2020 to 2021, partially attributed to COVID. The payer mix metrics for Medicare are right on the year before. The Medicaid rates climbed. There was a noticeable increase in Medicaid rate. The states that HCA is doing business in have very large Medicaid populations. HCA does not have a large exposure, though. The increase was large, but not a major payer mix change. One of the interesting things is the Goodwill figure reported on the financial statements. It says Goodwill is not amortized, but is subject to annual impairment tests. In addition to the annual impairment review, impairment reviews are performed whenever circumstances indicate a possible impairment may exist. Impairment testing for Goodwill is done at the reporting unit level. Reporting units are one level below the business segment level, and our impairment testing is performed at the opening division level. We compare the fair value of the reporting unit assets to the carrying amount on at least an annual basis to determine if there's a potential impairment. If a fair value of the reporting unit asset is less than their carrying value, an impairment loss is recognized. Fair value is estimated based on internal evaluations of each reporting unit that include quantitative analyses of market multiples, revenues, cash flows, and reviews of recent sales of similar facilities. No goodwill impairments were recognized during 2022, 2021, 2020. In finance, you can sometimes count the same dollar multiple times. The more solid figure for the goodwill to be predicated upon is the Chivalry personality traits of the HCA physicians. The hospitalists, surgeons, the GI docs, and those endoscopy centers. Those are the real rock-ribbed goodwill, because that is the predicate for return business, where patients choose to return to the hospital, the clinic, or endoscopy center, or recommend it to others. It's very challenging to attach goodwill to financial benchmarks, where the distinction between a facility fee and the physician that brings that service to the hospital is like the difference between a cover charge going into a bar and a service that people would actually be willing to pay for. The goodwill number's got to be attached to the caregiver. Medical school is the most expensive investment that an individual makes. Having physicians aligned with the organization is the key measure of goodwill. It's being measured in the wrong way. The quantity could be totally right, but that's something that could pose a hazard in the future, which can be quickly rectified by psychometrics, looking at the Chivalry traits, 13 Chivalry traits of the soul, traits of biology of the physicians, because it's a rock-ribbed conservative measure of goodwill. It's a measure of how much physicians care about their community, and is the more solid measure of goodwill, irrelative of GAAP. Accountants have given bad advice often to investors and bondholders in the healthcare sector. It happens to be, show me the goodwill. Show me a patient that could attribute that goodwill number. Like, I'd challenge the accountant at HCA, because again, HCA is a trusted, respected organization with a great track record that, for whatever reason, has a junk bond status. And one of the aberrations that can be cleared up is this goodwill number. Every single patient of HCA knows how they feel when they interact with one of the physicians. That's what Goodwill is. Uh, is their relationship in the community. The imaginary numbers that are described by the accounting policies are outrageous and baseless, and are embarrassing, to open markets. They're embarrassing again to the healthcare sector. It's not management's fault. It's not the organization's fault. Again, HCA is a high-quality organization that has suffered of bond rating firms that don't understand what investment grade is. The investment grade status of HCA is arguably higher than what has been rated by both Moody's and S&P. Moody's, we sometimes forget that Moody's failed in its first function of rating the bonds of railroad companies, where America has lost its railroads to the Canadians because the Canadians were not given such harsh non-investment status based on, again, purely theoretical, as if we stopped finding railroads investment grade. Railroads are investment grade. Moody's, again, is implicated in ruining America's railroad leadership, something that both political parties and almost every United States governor is smarting from, because we can't get our own goods on our own rails without asking the Canadians for permission. The Moody's rating of HCA debt's outrageous. We offer an accrediting option for HCA of quality and finance. We know that the personalized marketing of your physicians is significantly understated. We have the market-leading psychometric to help correct that. We know that the quality ratings from the Joint Commission are a drain on the reputation for the industry. The opioid epidemic happens to tie back to the Joint Commission mandating pain scales in the community setting, something that was irresponsible and unacceptable. The management discussion at HCA doesn't mention it. It can. The fact that their creditor, the Joint Commission laid an egg for the last 20 years and caused the opioid epidemic is a big reason why the Goodwill number isn't larger. Again, HCA and a lot of other organizations have been, conservative on prescribing practices. That happens to be another service that we offer, is prescription audits. We know that physician prescription audits can quickly identify opportunities to increase the Goodwill number. There's such a large proportion of physicians that have become so conservative. We happily do that work with HCA. We know that the Goodwill and PR out of that work could be really exceptional. I happen to be involved in the creating the algorithms to help Cardinal Health with their diversion prevention activities, which they're upstream at the wholesale level. And we know that HCA are good corporate citizens. Things that are not stated but does deter investors are real problems, of which the Joint Commission is one of them. Moody's is another one. Moody's has not done HCA any justice. It's so bizarre that Moody's set the total revenue figure as one of its criteria for giving a high bond rating, and still gave HCA a junk bond status. Hard to understand that. But we'd love to help with personalized marketing, with prescription audits. For HCA, we know that could increase the market value for HCA significantly. Looking at our charts, again, we can be reached at profi.me. And we reach out to the board of directors at HCA. Again, we applaud you. Think you're doing a good job. We think your accreditors have done a horrible job serving you. We think that Moody's has done a horrible job serving you, and we think that the steady growth of the stock is basically signs that there's been good performance particularly financially. Although getting the full utilization out of those facilities is going to take personalized marketing, and something we're going to help with. HCA, have a great day.